Hi, I'm Dr. Yashomati Dhore Patil, practicing at Yashomati's Dental Clinic in Kalyani Nagar, Pune. So today our topic will be what is root canal treatment? So let's go through these points. What is basically root canal treatment? Root canal treatment, also known as RCT, is where we clean the pulp tissue of the tooth so that we remove all the infection, pus, and fill the root canals with a bioceramic sealer or a normal sealer, and then fill it up with a gada percha. What is gada percha? It is basically an artificial material that is used to fill up the canals. How do you know that you need a root canal treatment? Number one, if there's a lot of pain in the tooth, there's a lot of pus discharge from the tooth, there's a boil that is present in the gum of the tooth, or there's tenderness of the gum, or also when there is a huge swelling on that side of the tooth which is involved. What should you do next? Number one, book your appointment with your root canal specialist or your dentist. So once you come in, we first assess the tooth. We remove a digital x-ray of the tooth. Once the digital x-ray is removed, we assess how deep the infection is. Is it superficial, or is it periapical, or is it a cyst or a granuloma? Once that is done, what we start is start cleaning the tooth. What does cleaning of the tooth basically mean? So we use an instrument called as an endomotor, which looks like this. So basically with push and pull movement, we clean the canals of the tooth. So this helps in clearing the pulp tissue which is infected in the tooth. So once you do this, we use an irrigation solution. Basically, the irrigation solution is activated with this endosonic activator or a sonic activator. So basically, once the liquid is in the canals, we push the tip of the sonic irrigator into the canals and disinfect the area completely. This ensures a very good, clear, clean environment which is free of infection. After that, we apply a sealer along the canals of the tooth, and then we fill up the material with gada percha. This gada percha material is an artificial material. It is biocompatible, so there are no chances of reinfection in that area. After that, we fill up the tooth with composite restoration, or we go in for a GIC restoration. Post 3 to 4 days, once the tooth has healed completely and is free of infection, we place a crown on the tooth. So this crown, there are different types of crowns available in the market. It depends upon which crown is used. There are different crowns which are used for different purposes also. So post your crown is placed, what precautions you need to take? So before your crown is placed, the most important precaution that you need to take is avoid eating from that side of the mouth, because generally what happens is when we do a root canal treatment, we remove all the pulp tissue. The vitality of the tooth is gone because we remove the pulp tissue of the tooth. So because of this, there is no blood supply or nutrition that goes to the tooth, and that's why it is mandatory to place a crown on top of the tooth, because when the crown is placed, it gives strength to the tooth. So if you try chewing on that side before the crown is placed, it can lead to fracture of the tooth, and you might have to extract the tooth, and you might have to go in for a dental implant. Like, this is what a dental implant looks like. So, but a dental implant is another different process completely, where you need to drill the bone of your jaw and you need to place an implant. So it is better to save your teeth before, and preventive checkups are very important. These help save your teeth before a root canal, before your implants, or before your crowns. Thank you.